So, first of all, what is biosafety? Biosafety is the application of safety precautions that reduce a laboratory's risk of exposure to a potentially infectious microbe and limit contamination of the work environment and ultimately the community. What is BSL? It is a series of protections specific to autoclave-related activities that take place in biological labs. Biosafety levels are individual safeguards designed to protect laboratory personnel as well as the surrounding environment and community. I will be explaining about biosafety level 1. So what is BSL1? It is the lowest biosafety level where we handle safe and non-harmful microorganisms. The primary containment is standard microbiological practices are followed. Works can be performed on an open lab bench or table. PPE are worn as needed, such as lab coats, gloves, and eye protection. Next is the secondary containment. The laboratory is not necessarily separated from the general traffic patterns in the building. The lab should have doors to separate the working space with the rest of the facility. A sink must be available for hand wash. Moving on, biological containment. They are only low-risk, non-pathogenic microorganisms and not known to cause disease in healthy human adults. For example, Bacillus subtilis and yeast. Next is the health and safety practices, where we disinfect benches before and after experiments. Use aseptic techniques to avoid contamination and use mechanical pipettes. Next is application of biosafety principles, such as the use of PPE like goggles, gloves, and a lab coat, and always do a daily decontamination of all work surface when work is unfit. Lastly is the emergency procedures. For spills, stop all of the lab work and alert other people. Cover the spill with disinfectant such as 70% ethanol. Let it sit for 20 to 30 seconds and then wipe off with paper towel and dispose it properly.
That is all. Next, I'll be continuing with our explanation of biosafety level 2 by first summarizing what BSL2 actually involves. What is BSL2? BSL2 is used for handling moderate risk pathogens, microorganisms that can infect humans through inhalation, ingestion, or contact with the skin or mucous membranes. Compared to BSL1, this level includes extra precautions to prevent accidental exposure through splashes, cuts, or aerosols. Now we move on to primary containment for BSL2. This focuses on the work practices and behaviors that keep people safe when handling moderate risk biological agents. In a BSL2 lab, work involves organisms that can cause illness, so personnel must have specific training to work safely. Access to the lab is restricted whenever experiments are being carried out. Good microbiological practices are strictly reinforced, especially for handling cultures and equipment. Any procedures that might produce splashes or aerosols are performed using proper safety equipment, such as a biosafety cabinet. Finally, all materials and waste must be clearly labeled with biohazard symbols to prevent accidental exposure. So these practices ensure protection for both the researcher and the surrounding environment. Now we look at secondary containment. This refers to the physical design and safety features of the lab that help prevent exposure. A BSL2 lab has lockable self-closing doors to control entry. Work surfaces and bench tops must be smooth, easy to clean, and water resistant to avoid contamination. The lab is equipped with an eye wash station and a hand washing sink for quick response to accidental splashes. Good lighting and appropriate ventilation flow into the lab help maintain a safe working environment. A Class 2 biosafety cabinet may be installed when procedures could generate aerosols, and windows are sealed or fitted with screen, and an autoclave is available for proper waste treatment. So together, these features ensure that potentially harmful agents remain contained within the facility. For biological containment, BSL2 labs often work with agents such as Salmonella, Staphylococcus aureus, measles virus, herpes virus, and human blood or body fluids that may contain hepatitis B. Because of these risks, workers may require immunization when necessary. Because many BSL2 organisms can spread through droplets, we work carefully to minimize splashes and aerosols, use mechanical pipettes, handle sharps safely, and decontaminate our work surfaces daily. Always must also be properly decontaminated. For applications of biosafety principles, it is to ensure safety, During daily work, we follow standard microbiological techniques, use biosafety cabinets for aerosols generating tasks, rely on autoclaves for decontamination, and wear PPE at all times. SOPs and the biosafety manual must always be accessible, and all work is supervised by a trained and competent scientist. Now, in the event of a spill or accident, the response must be quick and systematic. First, leave the room immediately and warn others while closing the door. If any part of the body is exposed, remove contaminated clothing and wash the affected area thoroughly. We then allow aerosols to resettle before re-entering. Once it is safe, we wear protective clothing, cover the spill with disinfectant soap towels, and let the disinfectant sit for at least 20 minutes. After that, clean-up materials are placed into biohazard bags, and finally, the spill is reported to the supervisor. And that concludes my section. Thank you.
Okay, what is BSL3? BSL3 is a biosafety level 3 which is referred to the laboratory design to handle infection agent that can cause a serious or potential lethal disease through inhalation. And this lab uses a specialized engineering, control, strict procedure, and control airflow system. And the main goal is to protect laboratory personnel, the environment, and the surrounding community from airborne infection risks. Okay, in primary containment of a BSL3 laboratory, all work involving infectious material must be carried out inside the Class 2 or Class 3 biological safety cabinet. So this prevents the release of the aerosol during the procedure. And the personnel must follow the strict aseptic technique and wear a complete PPE, including a glove, laboratory gown, eye protection, and respirator. Access to the laboratory is restricted to the trained and authorized individual only. And for secondary containment, the second layer of protection comes from the facility design itself. So the L3 lab operates under negative pressure to ensure the airflow into the room but not out. So all exhaled air is passed through the HEPA filter before being released, and the wall of the surface are sealed to allow easy cleaning and decontamination. And many BSL3 labs also include an oral room to ensure the safer entry and exit. Application of biosafety principles. Biosafety principles are applied through careful risk assessment before any laboratory work begins. Risks are controlled through a combination of engineering control, administrative control, and appropriate PPE. Equipment such as biological safety cabinet must be certified regularly, and facility undergo routine inspection to maintain safety standards. For last part emergency procedure, BSL3 laboratory follow a clear emergency procedure, and small spill inside the BSC can be managed immediately using a correct protocol. For larger spill or aerosol release, personnel must evacuate the laboratory. Any exposure such as needle stick injury or splash incident must be reported immediately for medical evaluation. Afterward, the affected area is decontaminated with approved disinfectant, and the incident is documented so improvement can be made.
Next, I'm going to introduce about the world of Biosafety Level 4 or BSL4, which is the highest level of biocontainment that reserved for a risk group for agents such as the Ebola and Marburg viruses. These viruses, which pose a life-threatening risk and lack effective medical countermeasures. This becomes the biggest reason why BSL4's fundamental mandate is total and absolute isolation. Firstly, primary containment focuses on the worker, where the researchers must utilize one of two critical primary barriers, which is the first is the Class 3 Biological Safety Cabinet or BSC Class 3, an airtight glove box system. The second, more common method, is the full body air supplied positive pressure personnel suit. This suit supplied with filtered air, maintaining higher internal pressure. If the suit breaches, air rushes out, preventing contamination from entering. Next, bear in mind that safety practices are absolute. Personnel must change into specialized scrubs and work under a body system. After work, the suit is chemically decontaminated while still being worn. The researcher then showers upon exiting the facility to finalize the decontamination process. Extensive training and annual competency assessments are mandatory. Then, the BSL-4 laboratory designated as the secondary barrier, which also known as a box within a box, constructed as an isolated zone. The entire lab operates under negative pressure, ensuring air overflow inward toward the highest contamination area. All exhaust air must pass through redundant HEPA filters or HEPA filters before being discharged, and all solid waste is sterilized passed through autoclaves, while the liquid effluent from sinks and showers must be chemically or heat treated before release. Entry relies on airlocks with interlocking doors to maintain the pressure cascade, ensuring containment is never broken. Lastly, for the emergency procedures, a contingency planning requires system redundancy. Critical systems utilize backup power generators that instantly activate to maintain negative pressure during any power failure. In case of a soot breach, the emergency protocol requires immediate isolation and chemical decontamination. The exposed individual is then transported circularly to a specialized biocontainment patient care unit or BPCU for medical intervention, while regular emergency drills are mandatory to ensure automatic and correct staff response. This shows that this level of biosafety is essential for global health security, as BSL-4 allows scientists to safely study these critical pathogens, enabling the vital research needed to develop diagnostic tools, vaccines, and therapies against future biological threats.